What's made some news in the last probably month has been Pfizer especially has went on record saying that they will very likely be releasing a booster for people who have already completed a vaccination series later in 2021. So, Dr. Evans, why would we need a booster later this year?
So I think some of that remains to be seen. There's certainly the concern that some of the variants that are developing, the UK variant and the variant in India and things, are less susceptible to the vaccine than the original wild type virus was. So I think one of the theories there is if you have even higher doses of antibodies in your system, you will be able to ward off even some of these variant viruses. It's hard to know whether this is going to be a one and done pandemic or whether this is going to be something that we see year after year, like influenza, that consistently mutates and changes course and has to be chased every year. It certainly looks more, from the beginning of this, it seems to follow more of the other viruses like it, the MERS and the previous SARS-1 virus, which did not have rapid mutation and yearly endemic problems, but time will tell on that. But it again goes back to the need to get as many people vaccinated as possible now, so we can extinguish these variants and burn out these fires so they don't have a chance to take hold and keep increasing and then end up mutating and causing problems year after year.
It's not surprising that we have a Brazilian variant, an Indian variant, and UK variant given over the end of 2020 and beginning of 2021. These three countries had dramatic outbreaks, nationwide outbreaks. I believe the statistics from India is that only 1% of the population is vaccinated. So it allows for this huge pass back and forth, more people being infected. And in general, the more times you allow this to keep reinfecting people, the more potential you have for a dominant strain to emerge. Is that fair?
That's what I understand, yeah. And it's, again, the faster we can keep this from spreading and get it behind us, the less chance it will to be able to develop new variants that are resistant to the original vaccine. And that's really the goal.